Wabarakatuh, Shalom, Om Swastiastu, Namo Buddhaya, Salam Kebajikan. Honorable judges and my fellow future leader in healthcare. If you look at the stethoscope, you might see it's just an ordinary medical tool. But to nurse, it's an instrument for deep listening. It's specially designed to capture hidden sound, weakening pulse, a gasping breath, and the silent struggle amid the chaos of disaster. It reminds us that safety begins by listening to the pulse of reality. Hello everyone, I'm Nabila Saputri Tomo, proudly representing STIKES Dian MOJOKERTO. Let us shift our perspective and talk about the crucial transition from bedside to blueprint. Nurse as architect of safety. Reflect on recent volcanic eruption in Indonesia beyond lava. Toxic ash triggered a 60% spike in acute respiratory infection. While thousands suffer from psychological trauma, on the front line, nurses perform rapid respiratory triage and psychological first aid. We make up nearly 60% of deployed emergency healthcare works. Yet, ironically, nurse involvement in strategic policymaking remains below 5%. Policymakers often manage crises from cold office. Suffering from political deafness, they do not hear the empty oxygen tanks or staff exhaustion. But remember, you cannot treat heartbeat you cannot hear. In the middle of that failing ass and mass panic, nurses are the ones standing on the front line. Through our stethoscope, we hear those gasping breaths firsthand. We perform rapid respiratory triage and provide psychological first aid to save life. Therefore, leaving nurse only at the bedside is structural tragedy. What we hear and experience must be translated into the blueprint of disaster management. We must reclaim a new role, nurse as disaster agent, and today I offer that tactical blueprint through the principle of S.I.G.A.P. S.I.G.A.P. As surveillance, nurse map vulnerable group beforehand. Accurate surveillance can reduce fatality rates by up to 50% during early evacuation. I. Intervention. We master the golden hour, immediate clinical stabilization, post-trauma reduce secondary death by 3 times. G. Galvanize. WHO states 80% of emergency failure are due to poor communication. Nurse act as conductor, uniting doctor, logistic, and volunteer and harmony. A. Advocates. We bring clinical realities directly to the boardroom to demand evidence-based policy, not assumption. P. Public empowerment. Communities trained by nurses have a 4-time higher survival rate. We turn passive victim into first responder. This thing, guys, resilience is a voice that refuses to be silent by calamity. When nurses become the architect of policy, we ensure that disaster response is synchronized with the real rhythm of human safety. To the policymaker, put down your generic manuals, open your door, and connect yourself to the reality brought by nurse. Invite us to the table where the blueprints are drawn. And to my fellow nurse, especially the entire academic community at STIKES Dian MOJOKERTO, speak louder. Do not let insight from your stethoscope. Stop at the bedside and let us transform the heartbeat we save today into strategic policies that protect the future of our civilization. Thank you very much.